I'm Dr. Daniel Haber, and I'm the director of the Cancer Center at Mass General. The panel discussion was great. I had the good fortune to be the moderator, and we had 3 CEOs of really fantastic biotech companies, each with a different take on the question. For us, it was about antibody therapeutics and cancer, which is a very, very hot area, very exciting. And each of the CEOs had a different view, a different challenge, and different opportunities. And they were very, very transparent and honest in describing both the excitement and some of the challenges there. So it was a level of depth. I know the field as an oncologist and a cancer center director, but the perspective of the CEO of a biotech company is very different. For the last 10, now 20 years, it's been a series of breakthroughs of novel therapies, novel approaches. So we're kind of living the world of scientific revolution, where every week there's another treatment, there are constant innovations and discoveries. You can't take care of cancer patients without knowing what's going on research-wise. You have to make that available to your patients in terms of novel therapies, and your own experience as an oncologist can help guide the way these drugs are developed. So we're really living at the nexus of research, innovation, and delivery of care in cancer. It really has been 20 to 30 years where this is the period of time now where faster and faster there are more discoveries about how to tackle cancer and more things to do about it, more drugs, whether they're small molecules, antibodies, targeted cells. There's a whole kind of entity of different therapeutic options that didn't exist before, and it's moving very, very quickly. The hope now, though, is that there's a lot of emphasis on early diagnostics in cancer. If you can catch cancer early, before it spreads, you can cure it with radiation or surgery. So our dream for the next 10, 20 years is that we'll capture and we'll identify cancer way before it causes symptoms, when people don't even know they have it, but you can find it early. And then all the treatments that now could make cancer into chronic disease could actually cure it. So our hope is really to cure cancer in the future. I think we all live in our own bubble in a way. Yes, we all read the literature, we all talk to each other, we all Zoom together, but we don't often meet. And there's definitely a lot of industry meetings, there's more than enough academic meetings. It's actually pretty cool to bring the two together in this venue where everybody is accessible, everybody can ask a question, make a comment. So it's bringing together two sides of the world that aren't often together. And there's a real focus on biotech, which is again a big Boston thing. And I think biotech and academics have a lot to kind of feed off each other and support each other. I think we have 2 roles in bringing drugs to market. The one that certainly we do a lot at Mass General, which is that we have our Tremere Center for first-in-human and targeted therapies. So we have the venue where if a company has a drug and it's never been tested before, but it's very promising, we test it out. And we have a very large number of clinical trials. We monitor patients very carefully, and we work in partnership with the drug company to measure how well the drug is doing, what are the mechanisms of side effects, the mechanisms of resistance. So that, if you will, is a place where drugs get deployed. I think now in the world of immunological therapies, the arrows go both ways, because a lot of the targets for antibodies are developed in research labs. Often we make our own antibodies and would partner with biotech companies to develop them. So in some way it's become a very, very bilateral relationship, and again to the benefit of the patients that we treat.